we can start.
Yeah, go ahead.
Okay, ma'am. Yeah. Uh, so, good evening, everyone. It's my absolute pleasure to welcome you all to today's special gathering hosted by our organization, Life Extension. Life Extension is a community built for people who are passionate about longevity and curious to learn more about it. Our mission is to make longevity research easy to understand, encourage collaboration across different fields, and create opportunities for learning and taking meaningful steps towards a healthier future. We believe longevity isn't just about living longer, it's about helping everyone live better, healthier lives. So, speaking about my team, I am Yash, and with I have Ajinkya. We are computer science students, and while Saili, Ishika, and Mridmay are masters in biotech. So, Saili, yeah, Mridmay.
Thank you so much, Yash. So, good evening to everyone present here today. Today, we have a very special guest speaker with us today, and it's my pleasure to introduce our esteemed guest, Dr. Shabnam Das Kar ma'am, a globally respected functional medicine doctor and an expert in anti-aging, brain health, and women's wellness. Dr. Kar ma'am is the Director of Medical Education at Better Medical Center in Calgary, Canada, and a guest faculty member at the Maryland University of Integrative Health. Before moving to Canada, she practiced as a consultant obstetrician gynecologist in Mumbai, India. Her impressive academic background includes an MD in obstetrics and gynecology, a fellowship with the American Academy of Anti-Aging Medicine, and advanced certifications in endocrinology, in autoimmune diseases, and Alzheimer's prevention. She is available and changed. Dr. Karmam has spoken at leading global conferences, including the 4 a.m. events across Asia and the Middle East, obstetrician gynecology conferences in India, and health innovation summits in Canada. She continues to educate and empower both patients and professionals through her workshops, webinars, and startup advising. Her key interests include anti aging medicine, hormonal health, autoimmune conditions, and the connection between gut and the brain health. Please join me in warmly welcoming Dr. Shabnam Daskar, ma'am.
Thank you very much, Saidi. That was very nice introduction. I just want to clarify a little bit. I don't really call myself an anti-aging doctor because the term has it needs to be clearly defined. So I'm a functional medicine doctor, and my areas of interest, as you pointed out, women's health. I'm former OBGY, but brain health and particularly better blood pressure management. And I am so excited to see so many young people interested in longevity. And, Yash, as you mentioned, to understand the longevity science, that's like a tall order. I'm not sure too many of us really understand. So, how does it go? Do you all introduce yourselves here, the guests and everybody, or what do you want me to do? We have Dr.
You can
Anjali.
present.
Yeah, so I'm driving, so I don't think I can really put on my video. I
Okay,
just,
no problem.
yeah, I'm a lifestyle medicine physician and I work with various kinds of work on various kinds of programs, all very lifestyle medicine oriented.
Okay.
And yeah, and longevity is one of the recent additions to our repertoire, and very happy to be here and listening to you.
Thank you. And who else do we have? We have Akash and we have Borsha.
Hey, hi everyone. Barsha here. So I predominantly work as supply chain consultant in one of the analytics firm called Tredence. My interest in longevity started when I attended ISC conference. It was a 3 day conference, which kind of opened, I would say, a lot of pathways for me to explore. And since I do have an interest in health tech per se, because I did work previously with one of the med tech company as my client. So that also foster my interest into exploring this area further. So that's one of the reason that I chose to participate here. Yeah. Thank you.
Awesome. Akash, what about you? Okay, Akash is still muted, I guess. So, um, oh yeah. Hi, Akash. Akash, you're muted.
Problem.
Okay.
Can you hear me?
Yes, we can.
Yeah,
I
yeah.
can.
Good to see you, Doc. How are you doing?
I'm doing good. How about you?
I'm good. Okay, just a quick introduction. I'm Akash. I'm the founder of Sutuletics. Sutuletics is a global platform where we, in short, fix everyone's health all over the world. And Dr. Shabnam also happens to be on our team, and we have helped many people together. And longevity is something that absolutely intrigues me, and is something that I look forward to on Sutuletics as well. So go ahead,
Thank,
Doc.
thank you. Thank you, Akash. Thank you, everybody, for being here today. So, first of all, I know y'all explained about all of your why you are interested in longevity, but I am a clinician, which means I am a doctor who sees patients. I am not a longevity researcher or a longevity medicine doctor. So I am still dealing with chronic conditions like hypertension, diabetes, mood disorders, autoimmunity. So my perspective is going to be from the perspective of a clinician. So as you will know, in the longevity world, there are different types of people who work in it. There are a lot of researchers, and many of the researchers don't actually see patients, so they're not clinicians. Then there are people like me who see patients, but I am not into the research. So that is a big difference because as a clinician, we always look for what is translatable. So translatable meaning from research, what can we get? Like, what does it mean for my patients today? How is it going to change my practice? So, Yash or Mrinmay, who's going to start? With just a little bit of background. Yash, Saeed,
Yes.
Mrinmay, go ahead.
Hello.
Yeah.
Yes, ma'am. Yeah. So I have a question about uh, so yeah, Bridmai, can we start our questionnaires?
And all of you can turn on your videos. It's nice to see you. Those who can. I know some of you can't.
All right. So, ma'am, I would like to ask you, how would you define longevity in the context of functional medicine?
So, first of all, I think I need to take a step back and explain what is functional medicine because not everybody is aware of that. And I think someone's, maybe you can mute your, we get some background noise. Okay, sorry about that. So, what is functional medicine? I'll explain briefly. I'll just share a slide because sometimes it's easier to explain with a slide. Okay, so I assume you can see my slide. Where did my, sorry about that. I am less familiar with Google Meet than, so is my screen visible?
Yes,
Can
ma'am.
you see my
Yes, ma'am.
screen? Okay.
Yes.
Sorry about the temporary glitch. So, what is functional medicine? How functional medicine is different from regular medicine, and we call it Western medicine versus you can call it conventional medicine. So the medicine that we are used to. So what we did is Back in the days when specialization was extremely important, medicine was divided into different, departments. And these, for example, gastroenterology involved, diseases of the gut, and cardiology of the heart, and obstetrics gynec, that was my specialty. But the fact is, and it did serve a very good purpose, because specialization was very important, is still important in many areas. But what we do in functional medicine is, instead of looking as, each of these organ systems as individual silos that don't talk to each other, what we do is we look at the whole patient as a network of networks. I know many of you are in computer science, and so for y'all, networks are like, there was a time I thought, oh, y'all have actually borrowed the term from us. But anyway, you understand what a network of networks is. So these are all the different areas we look at, and we would ideally like to look at all these areas in every patient. But as you can see, that is not always possible. But the fact is, it's important to know that all these things impact a person's health. For example, I'm not going to go into each one of them in detail because that is going to take forever. So, something like, for example, adverse childhood experiences. So, how a person's childhood was. Did they have a lot of experience, a lot of poverty? Did they experience a lot of domestic violence? Or was it a neglectful childhood where, they didn't have anyone to care for them? They didn't have anyone to bother whether they had enough food. Those things impact long-term health. And particularly one of the areas is, as diabetes is one of the most common problems worldwide, diabetes, gut disorders like irritable bowel syndrome, mood disorders, psychiatric problems. But the fact is, just because someone has had a difficult childhood, that doesn't mean it's all doom and gloom. There are a lot of strategies which can help. So let us say a child who's experienced a lot of domestic violence. That person, child, has a very caring grandparent. That can change their long-term health trajectory. So these are some of the, like, I won't go to all of into all of the details. Another one is chronic systemic inflammation. That rules almost every disease you can think of, whether it is a heart disease, whether it is stroke risk, whether it is dementia, whether it is mood disorders. And because we are talking about longevity, Yash, you asked how we look at longevity. So in the functional medicine world, and I'm going to stop sharing my screen. So, in the functional medicine world, when we talk about, and as you rightly mentioned, like, no one wants to be 100 years old and, sit in a wheelchair in a nursing home, not recognize their relatives. Everyone wants to be active and healthy and live a meaningful life right into their, older age. And is that going to be 80? Is that going to be 100? It depends. So in functional medicine, the three most important things we look at, because those are the three things that impact our quality of life. First is, movement, memory, and vision. So if you think, these are the three things that are the most important things. Now, next comes, is it possible that people are going to remain, disease free when they are older? No, not necessary. But the fact is, can people still retain their ability to think clearly, have perfect or good memory, able to move? Maybe they may need some, assisting devices, but they still can move and they can see. Can they still do all these three things, even if they have some chronic conditions like diabetes, hypertension, or, autoimmune conditions? Yes, absolutely. So my view as a clinician is, while we wait for all the wonderful, therapeutic stuff that is going to come out in the next, like, I am a techno optimist. So I know, and particularly when we have wonderful young people like all of you, working in that and interested in that field, we are going to have some major changes. Like, I was talking to somebody that day. I said, can you imagine a world where conditions like diabetes, and I'm talking mostly about type 2 diabetes, hypertension are cured. Like, right now, we are managing them. We are not curing these diseases. We don't cure any chronic disease. But what if there will be a time, and I'm quite hopeful there will be a time. I can't comment on the timeline because I'm not a researcher in that, where we will actually be able to cure many of these conditions, and I'm excited for that. So yes, it is many different things, but I think the most important thing is quality of life. And for quality of life to be good, there are a whole lot of things. Number one is, you know, what does someone want to do? Like, I meet a lot of people here. Here, people have, in Canada, I'm in Alberta in Canada. Originally, I'm from Mumbai in India. So in Canada, healthcare is covered by our tax dollars, and we have a very good healthcare system. Particularly, acute healthcare is really great, and people have, usually a rather good quality of life. But I meet a lot of older people. One of the first things they say is, this was a 92-year-old patient we had at the clinic. She said, Dr. Carr, I am like, I don't want to live any longer because all my contemporaries are either dead or they have got dementia or, they are dying. I am quite bored. Like, how much of, I don't like gardening. I'm like, how much of walking will I do? I can walk, but I'm missing the challenges of, which I had when I was younger. So we will have to start thinking about, not just expanding, our health span. Also, what are people going to do at that point of time? Like, boredom is quite a big killer. So Yash, does that answer your question?
Yes, ma'am. Yes, ma'am. Yeah. So, yeah. My second question will be like, what initially drew your field of anti-aging and uh, longevity science? What initially drew you to the field of anti-aging and longevity science?
So this was many years ago, and again, I have a fellowship from the American Academy of Anti-Aging Medicine. But the word anti-aging actually has many different meanings for different people. Like in Asian countries, I used to speak quite a lot. The commonest thinking is anti-aging means, aesthetics and skincare and, looking good. Now that is very important. I'm not dismissing it, but what really drew me, and now we call it more of functional medicine rather than, anti-aging, so putting people to their best function. What drew me initially was, this was many years ago in Mumbai. I was at a conference where I heard a doctor who had come from the US. He was talking about bioidentical hormones. Now, by background, I'm an OBGY. And as an OBGY, I had never heard of bioidentical hormones. And in India back then, we didn't use hormone therapy. Almost there was like nil. Even our menopause clinic at the hospital did not use hormone therapy. So that was where my interest was piqued. And then I realized, oh, this is a really fascinating way of looking at medicine. After that, I completed my fellowship and I became sort of like a super generalist. So instead of only hormones, now I look at, inflammation. I look at movement. I look at, diabetes, blood pressure, metabolic dysfunction. So thyroid dysfunction, gazillions of stuff. So maybe what you could, how you could describe a functional medicine doctor is a super generalist. And I think the other area where we are good at is customizing a patient's care too. And when we say, there was a time we used to say, personalizing, then personalized medicine came in. So it created a confusion because personalized medicine, a lot of people think of it as, we look at your, whole genome sequencing, we'll check your gut microbiome, we're going to do metabolomics, we're going to do proteomics, we're going to do transcriptomics, and then come up with a treatment plan which is, personalized to you. Now, all that is wonderful, and I'm sure all the pieces will fall in place. And but today, what we practice as functional medicine doctors is, how can we individualize the treatment plan to the patient, to the individual who's in front of me, depending on what their lifestyle is, what their life situation is. How much are they willing to change their lifestyle habits? And again, we also have to keep in mind that are they able to spend, how much of money will they be, are they willing to spend? So it's not always necessary that people don't have money. Even people who have a lot of money may not think it's a great idea to spend on health. Maybe having a fancier car is higher in their priority. So it's we individualize it to the patient, and that is where my behavior change training comes in. Because there was a time when, okay, every patient gets the same treatment, like it's a protocol. You have to do this, blah, 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 blah. You are not exercising. Don't you know you I mean, tell me, who doesn't know they need to exercise? Why is it that most of us are not able to exercise? Like Akash is here, he is into yoga and physical training. Is it that, we don't know? No, we all of us know. We need to exercise more. We need to lift heavy weights. But why is it that most of us are not able to? And I'm sure many of you in the audience are like Akash, I know for sure, is very much into physical fitness. You go to the gym regularly. Not everyone is like that. So telling that person, you need to exercise, you need to exercise, that doesn't work. you know so now what has changed in my how I talk to patients after my tiny habits training and my behavior design training, and I'll explain what that is I ask the patient which these are the things you need to do to achieve this outcome. Let us say I am looking at managing blood pressure or blood glucose levels, metabolic dysfunction. There is no one thing, like let us say blood pressure. So prescription medications work very well for hypertension. Are they taking their medications? If they are not taking their medications regularly, why are they not taking it? Is it that they have this mental block? I don't want any prescription medications, I want a natural therapy. Now for blood pressure of 160 by 100, there is not going to be any natural therapy which will bring it down soon. So what is the mental block? No, I heard someone say on the internet that prescription medications are bad. They're not bad for everything. Yes, they have potential side effects, but bringing down blood pressure of 160 by 100 to less than 120 by 80 with natural therapies alone, and I know natural therapies, so that is not a very achievable goal unless the person loses massive amount of weight and they're able to maintain their weight loss. So then my question is, okay, then I have to educate the person, like, why do you think prescription medications are not a great idea? So versus someone else, let us say another person, he's a shift worker. He works in multiple time zones. His employer is in the US, he lives in India. That person cannot, I cannot tell that person, you need to go to bed at 11 p.m. Like, you cannot stay up the whole night. And I'm sure many of you in this group, you all are students. And when you're young, I think many of you have pulled all nighters. And, when you're young, you can recover much faster. But again, telling a person who has a shift job to, you need to go to bed at 11 p.m., that is not going to help. So I will stop there. Any questions?
Ma'am, I have a next question for you.
Go ahead.
So, you are a trained in brain health coaching and Alzheimer's prevention, right? So, what
Mhm.
lifestyle habits most significantly protect cognitive?
Okay. Great question. Okay. And I did promise I'm going to tell you all what Tiny Habits method and behavior design is. The Tiny Habits method is a method of changing habits which does not require extreme motivation and willpower. And it came from the work of Dr. BJ Fogg at the Behavior Design Lab in Stanford. So BJ did a lot of work, helped a lot of people doing this. And his behavior design lab is, again, he uses certain frameworks to help people change behaviors. And some of his students have gone on to build uh, great, apps and a lot of programs and products and things like that. So Now, going back to what are the things that would prevent dementia, the fact is, I'm sure many of you have read this, and dementia is preventable, it is not curable. So, first of all, let me clarify. When we say dementia, Alzheimer's disease is the commonest form of dementia, but there are others. There is vascular dementia, there's Lewy body dementia, the whole lot of them. And many people with Alzheimer's are actually, they actually have mixed dementia. So when we say dementia, I want to, the ideal term would be all cause dementia, but I'm not going to keep saying all cause dementia all the time. So dementia covers Alzheimer's, which is the commonest, and it covers vascular dementia, it covers Lewy body, everything. Now, recently, this is like the last several, I think, few, I'm not even sure about the timeline. We are talking more about reducing risk for dementia rather than prevention. So 2020, I think the first Lancet Commission report came out in 2017, if I'm not mistaken about the date. And last year they had a review of that. So what they found is there are certain factors, and I'm going to mention what they are. If we can manage those factors well, then we can lower the risk of dementia potentially by about 40%. Now, that is very good on paper. So that's the reason we've stopped talking about, prevent dementia versus lowering dementia risk. So what are those, and all those things that matter? Number one is, again, these are some of the things are like they need a whole lot more research and more nuanced, conversations. One is early life education. So if someone has lower early life education, they have a higher risk. And again, there are multiple factors, because less education in early life can be for various reasons. Maybe that person didn't have an opportunity. It's not that their intellectual capacity was less. So that is early life education, diabetes, hypertension, and again, this is not in specific order, sleep, then hearing loss, vision loss, loss of sense of smell, then sedentariness, so sitting continuously for a long time. These are some of the major factors. So out of those, again, we have to decide which are the ones. Like I said, for every person, it may be different. Maybe this particular person doesn't have diabetes or hypertension, or maybe they have hypertension and diabetes and they are not managed well. So if you were to ask me what would be the number one way to lower someone's risk for dementia, so how I look at brain health is I look at three foundations. So number one is optimal blood glucose levels. Even if someone doesn't have diabetes, if they have been told they have pre-diabetes, they have PCOS, and they have had, pregnancy diabetes, these are all, they have fatty liver. These are all conditions where you need to take action. So that is blood glucose levels. Number two is blood pressure levels, optimal blood pressure levels. An optimal blood pressure level for most adults is below 120 by 80. For women, it is likely lower, and probably in the next few years, the guidelines are going to change. So women need lower blood pressure to prevent a whole lot of conditions, heart disease, stroke, and dementia and everything. Number three is low levels of chronic inflammation. So these are the three outcomes we want. And to achieve these three outcomes, there are gazillions of strategies. So if you were to ask me, like if there's just one thing that I would, and again, like I said, each person is different. If there's just one thing I would recommend, and Akash will be very happy, it is moderate to higher intensity exercise. So, and most of us are not there. I am not there. Like, I know it. I don't do moderate to high intensity exercise, 30 minutes every day. Most of the time I love going for walks. I'm very fortunate to live in a very beautiful part of the world, but walking is not enough for everyone. Anything is better than zero. So don't get me wrong that, you should not walk. But thinking that walking alone is going to give me all the benefits of long-term health, that is not true.
Okay, ma'am. Now I have one more question.
Go ahead.
That how you relate chronic inflammation with brain longevity? Like
Okay.
how both are correlated
Okay.
or contribute to each other?
So chronic inflammation is basically, it is called by different names. It's called as sterile inflammation. So it's basically like your our immune systems are at a high alert all the time. This is like a, if you imagine a, a coal fire, which is kind of just smoldering coals. It's not like a raging fire, and it's a smoldering coal fire in the background causing a lot of problems in our bodies. So high levels of chronic inflammation have been related to heart disease, heart attacks, heart failure, everything, strokes, hypertension, dementia, mood disorders, autoimmune conditions. So any condition you name, if levels of chronic inflammation in a person are high, then it's going to impact their long term health. And particularly, as we get older, I'm sure all of you have heard of the term inflammaging. So our immune system is actually the most important system in the body for our health. Every disease is an immune system problem, whether you're talking about heart disease, whether you're talking about stroke, about hypertension, about dementia, about autoimmune conditions, mood disorders, even serious psychiatric disorders like schizophrenia, bipolar disorder, depression. All of these are related to the immune system. And I think the biggest benefits in longevity are going to come from, when we get a handle on how to take care of our immune system better. And this is like, the immune system is so complex and so interesting. But unfortunately, we don't have, like I said, I'm a clinician, so I'm always looking for biomarkers. So biomarkers meaning blood glucose is a biomarker, blood pressure is a biomarker. I know the levels are high. If I do certain things, depends on what it is, uh, then I can check whether the levels are changing. But when it comes to the immune system, other than in research, and I don't know whether anyone in the audience is any research doing any research on the immune system, there are no easy ways. Like I cannot go to the lab and say I want my IL-11 to be checked, and again, if I check IL-11, what are the strategies that are going to help me in lowering it? What does it mean? So whereas chronic inflammation we can check, there is no marker for chronic inflammation. When an acute inflammation marker like hsCRP or ferritin persists for a long time, or there are no other markers of acute inflammation. Like we can check acute inflammation by doing a very simple test called a CBC, so complete blood count, that will tell us the lymphocyte count and things like that. And hsCRP is available everywhere, ferritin is available everywhere. Now, unfortunately, most patients, when they go to their doctor, even cardiologists will do a blood glucose, they will definitely do a lipid panel, they'll check blood pressure. Most of them will not do an hsCRP. hsCRP is a marker of inflammation, and if it persists for long, then we consider it as a marker of chronic inflammation. So if there is one, again, it has to be nuanced, because if I say that, okay, this is the one test you need to do, but if your levels are high and you go to your doctor and your doctor has no idea how to manage that, because not everybody knows that. Like they're going to think, oh, I'm going to put this person on an anti-inflammatory medicine like a, I don't know, ibuprofen or something. No, ibuprofen will not take care of chronic inflammation. So first is to differentiate between acute and chronic inflammation. And then the other big thing is food is one of the biggest sources of chronic inflammation. So that is also something I mean, I can talk about food until kingdom come. I don't know whether you want me to do that.
Yes, ma'am, please. That would also help.
How much time do I have? Because I'm looking at the clock. And I think we have some questions also. So okay, food. Now, most important thing is, what is food supposed to do for us? Like, what are the jobs to be done by food? Can anyone wants to volunteer any answers? Like, what is food supposed to do for us?
Provide nutrition.
Yes, definitely. And what else? Okay, we will go by providing nutrition. Yes, food is definitely supposed to provide nutrition. The question comes, is food alone enough? And my answer, simple answer would be no, food alone is not enough. And there are various reasons for that. The next thing that food, in my opinion, food has to do is keep blood glucose levels stable and within a very, very tight range. And the third thing it has to do is to keep inflammation levels low. So, food, now when I say blood glucose levels in a very tight range, I mean that for people with diabetes and without diabetes. And what is that tight range? In Indian units, it would be between 70 and 130 to 140 max milligrams per deciliters. And for those who use millimoles, please multiply those numbers by 18. So it has to remain in that very tight range. So, and if a person has diabetes, sometimes that person may need more than food. They may need more medications. So it's nuanced. It's not like they should not be in that tight range and get hypoglycemia. Like they are on insulin, they're on multiple medications. No. But for people, even those who don't have diabetes, that tight range is extremely important. And this has been related to long term health. So, the big thing in functional medicine is we don't wait for someone to develop diabetes and then say, okay, now you can take a metformin. If your fasting blood glucose has gone up to 95, your doctor will say, okay, you need to watch your blood glucose levels. And what is watching your blood glucose levels do to you? Whereas as a functional medicine doctor, I'll tell them, oh, you need to lower your carbohydrate intake. How much of carbohydrates are you eating today? And as all of you know, in India, our food is very carbohydrate heavy because everything is either rice or wheat or either rice or roti. I have to explain to people, here in India has like the eastern part of India is rice eating mostly. Western, northern is and southern also it's mostly, and western and northern India is like mixed, and now it's become mixed all over the country. So, and particularly for vegetarian people who are vegetarians from birth, this is really hard because each one of us has a what I call a personal threshold of carbohydrate tolerance. And since many of you here are from computer science and biotech, 2015 there was a game-changing paper. This is Dr. Zivi. It is called personalized blood glucose, and there is a 5-minute video abstract available online. So what he did is he checked, this was more than 800 people. He tracked them with a continuous glucose monitor so he could check the blood glucose levels after every meal, before meal, fasting, everything. They checked the gut microbiome levels, gazillions of testing. And what they found is, so back in the days, I used to show a slide of, a cookie versus a banana. What they found is the same food doesn't have the same blood glucose response. So what we call the glycemic response in everyone. So for example, I can tolerate rice. So when I did use the CGM, that is what I found out. I can tolerate rice much better than any of the rotis. I don't eat gluten. So even gluten-free atta like, ragi, bajra, all of them raise blood glucose levels very high. And this was actually a shock for many of my patients because sometimes people will ask me, what should I have for diabetes? I have diabetes. I said, I can't tell you. You need to get a CGM. Without a CGM, I can't tell you whether you are the one whose blood glucose will go sky high from having, atta or ragi or bajra, or whether you are one of those for whom rice is a kryptonite. So that is the personalized response we talk about. And so, like I said about food, one is carbohydrate. So prioritizing protein intake. Now, recently I posted this thing on LinkedIn about bone health. I was shocked to read the statistics that low bone mineral density is the like the biggest largest number of people in India. That is a very important cause of death. So bone mineral density is, and people think of calcium and vitamin D only. Protein is a very important factor when it comes to bone health. So Protein and fat, good quality fat, don't raise blood glucose levels as much as carbohydrates do. So carbohydrates, rice, roti, bread, pizza, pasta, potatoes, all the stuff, all the grains you name, those raise blood glucose levels a whole lot more. Now, most people are not aware of that because they are not checking their blood glucose all the time. They're not wearing a CGM, and they see a hemoglobin A1C at the end of 3 months, which is not a very good measure of blood glucose levels. It's a good measure of other things like glycation. So, food number one is, what are you eating? Are you eating enough protein? When I say enough protein, it's like at least 1 to 1.2 grams per kilogram of body weight. So once someone eats adequate protein and eats protein first rather than eating a carbohydrate first, their blood glucose levels are going to be very different from someone who eats carbohydrates first. And because protein also increases satiety, so you don't feel hungry as often. With high carbohydrate meal in 2 hours or 3 hours, you're hungry and you're craving another snack or something else. But you change that to higher protein intake, that is going to be very different from eating more of carbohydrates. And you eat, good fat like butter, ghee. Those can also tamper down the blood glucose response. So that is the next thing is, so I talked about what food. So prioritizing protein is important. So once you eat more protein, many people find automatically the carbohydrate intake will go down because it increases satiety, then you can't eat a whole lot of food. And for vegetarians, it is important that they will probably need protein supplement, because all the things that a lot of people think that lentils and beans like rajma and chole and all these are high in protein. No, they all have high carbohydrates as well. And the protein quality, animal protein is a better quality protein in terms of absorption and everything. And again, I don't want to get into a plant versus animal protein here because it's different reasons. If you are vegetarian in India, you're certainly not going to start eating meat and fish, but you do need to know that there are some things you have to be aware of. So protein supplement will save that, problem of higher carbohydrate intake from if you're trying to eat only protein. That's why I said you can't meet all your nutrient needs from only food. Then the next thing comes time of eating. And many of you were at the Longevity India conference, and I'm sure you heard Dr. Sachin Panda talk. So, Dr. Panda, it was really nice to talk to him. We had a nice long, and I have been on email communication with him for ever since his first, his app came out. That study was like way back, I think 2015 or something. So, Dr. Sachin Panda is a researcher in the circadian rhythm. So, circadian rhythm is basically your body's biological clock. You all need to tell me how I'm doing for time. I can keep talking forever. So, the circadian rhythm is basically our body's biological clock. Every cell has a clock, and this clock is, it's the how it starts is from light falling on the eyes and the it's a whole lot of stuff happens, and every cell in the body has a clock. And when I talk about eating food earlier in the day, so earlier in the day, what happens? Now, carbohydrates are something that our pancreas has to make insulin to manage the carbohydrate intake that we have. So, insulin sensitivity, which is the good thing, like you eat a certain amount of carbohydrates, some insulin is produced, it keeps your blood glucose lower, you don't get diabetes, levels are very stable and balanced. Insulin sometimes does not function well, so that is what we call insulin resistance. So, insulin sensitivity is the good thing. So, studies have shown that insulin sensitivity is better in the first part of the day rather than late in the evening. And that is one of the other problems in India we have. People have dinners very late, like 9, 10 p.m. So just making that small shift of having an earlier dinner versus a later dinner can change blood glucose response and metabolism dramatically. So next comes, so first is, what should you eat? Prioritize protein. Next, I talked about the circadian clock. So that is, when should you eat? Eating earlier in the day versus eating later has very different metabolic response. Third thing is food order. So food order, eating protein first versus eating carbohydrates first. Like, why do restaurants serve, bread at the beginning of the meal? They want you to order more. So eating protein and vegetables, let us say, first versus eating carbohydrates first will be a very different blood glucose response. The fourth thing is how many times someone is eating. So if we eat like two or three nutritious meals versus eating two meals and multiple snacks in the day because someone has told you your body's metabolism is not going to function well if you don't eat multiple times, that is completely wrong. So the number of times we eat, both our blood glucose and insulin levels go up. Now you want to keep that area under the curve very low. So eating multiple times is not going to help. And the important question is, why are you eating multiple times? Are you hungry? So if you're hungry, then we have to go upstream and fix what was your last meal. Was your last meal satiating enough, or did you eat more carbohydrates? So in 2 hours, your blood glucose levels come down and you're hungry, and you're not just hungry, you're hungry and angry. So angry. So, or do you eat snacks because you're bored? So there are different strategies for different things. And I'm going to stop there because I think we have some questions. I want to get to your questions. And if anyone wants to stay on longer, it's fine. I'm here for some time. And go ahead. So, Shweta, did that answer your question? Yes, Saili, do you have a question?
Yes, ma'am, I do. So,
Go.
coming back to how you mentioned hormones play the important role, right, in women's health as well as men.
Yeah.
So, how does hormonal health, especially thyroid and sex hormones, play a role in healthy aging for both men and women?
Okay. How much time do you have?
Uh,
So, thyroid is very important for many different things. And one is metabolic rate. And as you know, the higher the metabolic rate we have, the better our, not just body weight, the better our metabolism functions. And metabolism, as I've said repeatedly, is one of the most important things we look at. So, having optimal thyroid function is important for brain, heart, bones, everything. And when I say optimal, it's like, is it in a very tight range? Too low of TSH is one of the measures we use for thyroid hormones. The others are free T3, free T4 thyroid antibodies. If TSH is extremely low in somebody who's on thyroid medications, that can cause a lot of problems. One is it can affect heart, heart racing, heart rhythm problems. It can cause bone loss. So optimal versus, going into, sometimes people will say, oh, you need to increase your thyroid dosage. No, you cannot increase without checking. you know. So thyroid is very important. When it comes to hormones like, estrogen, progesterone, testosterone, in women, in the menopausal transition, so menopause is by definition when a woman's cycles, monthly cycles, stop permanently. The permanently word is important, for 12 months or longer. So someone may be in menopause, let's say 6 months have gone and they've not had a cycle. Technically, we still can't say she's in menopause. So what happens during menopause is the ovaries don't function the way they used to at a younger age. And I think because all of you are interested in longevity, I am very excited about, how we can change ovarian aging. Maybe a time will come. Some people say that menopause is going to be optional. And there are, again, we can go down many routes. It's like ovarian transplant from the patient's own younger ovaries if they have cryopreserved the ovaries. And they are, so some conditions, like, for example, some woman who's going to have chemotherapy at a younger age, and we know that chemotherapy is going to stop her ovarian function. They have been able to preserve the piece of the ovary earlier, and they could transplant it later and have it function. So that is very exciting news. And this is like fairly new. Then there are other ways of stimulating the ovary by using PRP. So sometime down the line, I think we will reach a point where there could be stem cell, like Yamanaka factors or something like that. There's a lot of research going on. Nothing is applicable like today, but I'm very hopeful. So ovarian function declines with age. And in India, the average age of menopause is earlier, actually. It's 46 years versus it's 51 years in the rest of the world. And in the menopausal transition, one of the most important thing that happens, particularly with relation to brain, and this is from the work of Dr. Lisa Mosconi, what she did in 2017 was, and if y'all are interested, I can post the papers later. I don't have the papers ready at hand right now. So what she did is, these were women in the menopausal transition. So the 8 to 10 years before menopause is called the perimenopause or the menopausal transition. And there are a lot of hormonal changes that happen at that time. What she found is these are women in the perimenopause. They haven't achieved menopause yet. Their brain started changing. So the brain's ability to utilize glucose as a fuel versus using ketones as a fuel changes. So in the menopausal transition, they have what is called brain glucose hypometabolism. Basically, the brain's ability to use glucose as a fuel is less. And that is a condition that happens even in mild cognitive impairment. So MCI is considered to be a stage which is pre-dementia. A lot of people with MCI will eventually go on to develop dementia, but not 100%. I think it's about 50 to 60% of people with MCI will eventually develop dementia. And this studies have shown that they have the same problem of brain glucose hypometabolism, which is the brain loses its ability to use glucose as a fuel, but the good thing is it still retains its ability to use ketones as a fuel. And I mean, I'm just a warrior of I'm just keeping an eye on the time. So, and the other thing that happens in the menopausal transition is women have problems of glucose metabolism at that point. They gain more belly fat, they lose muscle mass, and both those factors contribute to their long-term health of cardiovascular disease. Lipid changes dramatically. So to counter those problems, losing muscle mass, gaining belly fat, no one wants these things. So even women who have otherwise maintained body composition before that, during the menopausal transition, they find that, and there are estrogen receptors in the pancreas. So these hormones have multiple actions. Progesterone is also very important in different parts of the body. Another big challenge at that time for women is sleep. So they have sleep problems. Chronic insomnia is present in 70 to 80% of women in the menopausal transition and menopause. So these things can change a lot of things about women's health and make them, put them at a higher risk for cognitive function and mood disorders and, higher risk of cardiovascular disease and diabetes and everything. Now, men and testosterone is also very important. And testosterone is not just to make men, muscular people. Testosterone has a whole lot of functions. It has a lot of functions in the brain, in metabolism, very important. So low testosterone levels in men have been shown to be related to higher risk of diabetes or metabolic dysfunction. And unfortunately, worldwide, the levels of testosterone in men are going down in younger men, as well as sperm counts are going down worldwide. Two big things we need to think about. We don't know, there is no one specific reason for that. Some of the factors are the whole bunch of environmental toxins that we have, all these endocrine disrupting chemicals like phthalates and parabens and all the stuff coming from plastics and pesticides and flame retardants. I mean, I can go on and on. Some of these are called forever chemicals. They never go away. And they are actually causing a lot of problems. And unfortunately, at this point in time, we don't have an easy way of getting rid of them. Even if we detect the levels are high. So right now, the only thing most of us can do is reduce our exposure to toxic chemicals. So avoid eating from plastic containers, plastic water bottles, just throw them out, get a stainless steel bottle or glass. And those are just the basic. Food wrapping, limit the use of plastics with your relation to food and drinks. That's very big. And of course, pesticides, you can't always find out which food doesn't have pesticide. There's no easy way to know that. So, does that answer your question, Sally?
Yes, ma'am, it does. Thank you.
Okay, you're welcome. And someone had a written question. I mean, someone had typed a question, I think, in the chat box. I can't see it right now. Oh, yeah. Uh,
Uh, yeah, ma'am. Actually, Shiva asked a question.
yes, I can see it now. So Shiva's question is, and Shiva, are you on the? Do you want to unmute yourself and ask it, or do you want me to read it? Okay, I will read it out. So Shiva's question is, how can we help elder parents with high blood pressure and other metabolic issues change their habits effectively? Also, beyond common advice like diet and exercise, what other lesser known but impactful changes can support their health? And Dr. Anjali Bai. So, Shiva, that's a very important question, because one of the things I find, I get a lot of people where younger people want their parents to get healthier and they will force them to come and meet me, and I usually ask, whose idea was it to come consult me? Was it your daughter's idea, son's idea, or was it your idea? So number one is to help them do what they already want to do. That is a tiny habits and behavior design, one of the things we follow. So if your parents are comfortable with where they are with their diabetes, whichever way it is managed, and blood glucose levels, there is not a lot that you can do from outside, other than, and telling them will never change that. So the person who has the condition, whether it is diabetes, hypertension, whatever you want to talk about, poor sleep, that person has to want to change. And more importantly, what are the areas they want to change in? Giving them more information, and particularly telling them and haranguing them, you should do this, you should do that, I read here you should not eat sugar with your tea, and you should have this, and you should have, those things don't work long term. So yes, again, usually it's a good idea, Shiva, to come up with a bunch of strategies that they will want to use. Whether it is make a small change in the food, maybe instead of having dinner at 9:30 p.m., are they willing to change it to, initially don't expect them to start having dinner at 7. So initially just thin it down a little to 8:30 and ask them next day, how are you feeling? Most of them will say, I'm feeling way better when I eat earlier, I sleep better. So these are not simple things that I can, this is the protocol you need to follow. Most important is there has to be buy-in from the person who is living through that. And as sons and daughters, you'll want to do a lot of things for your parents, but they have to agree to it. Don't try to ram it down their throat. That is what I would say. Okay, do we have any other questions? Shiva, you're welcome. Yes, Akash, you can unmute yourself.
Okay, am I audible?
Yeah.
Okay, Doc, just a general question. There are a lot of supplements in the longevity and biohacking space right now, and you see a lot of people, a lot of experts talking about a lot of supplements. But honestly, there's not much research done in a lot of these supplements, but yet people seem to market them a lot, and people seem to grab them the sooner, as soon as they see them.
Yeah.
Any supplements over the years that has recently been launched or come into light that you have may perhaps want to look at, or where you have seen good results in some supplements, or few any of your top 2 or 3 supplements that you feel are actually worth investing in?
Okay, Akash, that's a very important question. Yes, in the longevity world, there is a lot of hype, and sometimes the science doesn't show that hype, like it doesn't support the hype. And we have already run out of time. I mean, we can go on and on. So sometimes what happens is, Akash, as you said, a lot of people who are selling supplements, they sound very persuasive, but they don't have the science backing. So they'll say, oh, this one can change mitochondrial health. And I think yesterday I posted on LinkedIn, Akash, how do I know how to measure mitochondrial health? Like, so if you want my simple answer, it's, and then again we have to differentiate between supplements and herbals. So supplements by definition are things that we need to add to our day, because we are not getting adequate amounts from our food. So if you ask me what are the top supplements, and these are not anti-aging supplements or longevity supplements or anything, they are for everyone. My number one would be preventing vitamin D deficiency. I mean, this will sound very simple. This is a longevity, webinar, and I'm talking about something as simple as vitamin D. Vitamin D deficiency is extremely common, and again, it is related to every disease you can think of. So, preventing vitamin D deficiency is important. And someone posted on that, I think, on the same LinkedIn post, in India, how can people have vitamin D deficiency?
Because of
We just want to go out in the 40-degree heat, and our skin color, we don't absorb. Most of us don't expose enough, body area to get to make vitamin D. So vitamin D supplements to maintain your optimal levels. Number two, which is omega-3 fatty acids. So omega-3 fatty acids are what are called essential fatty acids. That means our bodies don't have the ability to make them. So if our bodies cannot make them, we have to get them either from food and supplements, or food. Only food will not give enough omega-3 even to a person who eats, wild salmon every day, because the levels that we need are much higher. And you need to check your blood levels. So fish oil supplements, and then you need to check how much, and it's quite nuanced. But that is something I would recommend for everyone, except someone with atrial fibrillation. I'm not going down that route because again, atrial fibrillation it's a heart rhythm problem and quite common. So people who have low omega-3 levels are at higher risk of atrial fibrillation, but having excessive dose of omega-3 also raise the risk of atrial. Our human bodies are so complex. It's very hard to give like some. I have this. Should I do that kind of answers? Akash, those would be my top two. Then there is, of course, a multivitamin. There are studies which have shown that multivitamins, a simple or multivitamin, can reduce risk for dementia. Magnesium, B vitamins, iron, all of these are important, and particularly for vegetarian Indians, B vitamins and iron are two of the major deficiencies. And even actually people who eat non-vegetarians, not that they get a lot of B12. So those would be my important ones. And specifically for longevity, I am not yet convinced that there are any at this point in time. I might change my, what I say even 1 month down the line, given the fast pace of things that are happening. But again, it's very hard nowadays to be able to discern. Sometimes they'll say studies have shown, and you find out it's a preclinical study. There's no human trial done on it.
Thank
So, yeah,
you.
you're
Thank you.
welcome. Okay, shall we end? Because we've already gone about 12 minutes over the time. I'm happy to keep talking.
Ma'am, we
Any
have
more
one last
questions?
question. Yes,
Go ahead.
yes.
Yes, ma'am. I have a question. Like, as you said about the at the start that about tiny habits, can you please tell about what exactly it
What is
is?
it?
And
Okay.
as a tiny habits coach, how do you help people make long lasting life changes to support
Okay.
longevity?
Okay. So, as all of you know, behavior change is one of the biggest problems that we have, because I talked about exercise at the beginning. So, how do I use the tiny habits method to help someone exercise? And I started using it in my own life. So the tiny habits method is a method where, mm, like I said, you don't require extreme motivation and willpower. How it works is because it makes people feel good. So if I'm going to do tiny habits, let us say I want to be somebody who wants to start doing more of resistance exercise. So using dumbbells. So one of the things I did is, the tiny habit recipe has three parts to it. One is an what we call an anchor moment. So an anchor moment is something you already do. Then comes a tiny behavior. And the third part, the ABC, the C part of it, is something we call instant celebration. And what people make a mistake with is they think the tiny habits method works because the habit is tiny and it will gradually go up and up and up. No, it's not that. It's that our motivation goes up once we feel good. And we feel so. I'll describe one tiny habit that I started off with. So in the morning when I switch on my, tea kettle, my habit is, as after I switch on my tea kettle, I will do two dumbbell curls and then celebrate. Now, the celebrate in the Tiny Habits world, and if you have the book Tiny Habits, it will tell you there are more than 200 ways of celebrating. And celebrating doesn't mean I go and have a cookie at that point. It is something that is small and I can do instantly. So for me, my celebration was, imagine burst of fireworks, and it depends on what resonates with you. You may be someone who's like, good on you, and do a dance or something. It depends. Some of us are like more the introvert kind. We want something inside. you know. So my habit is, anchor moment is something you already do. So I switch on the tea kettle to have my tea. That every morning I have tea. So I will do that. I don't have to create a new habit to turn on my kettle because that habit is already existing. So after I switch on my tea kettle, I will do two dumbbell curls. Now, important thing is my dumbbells have to be near my tea kettle. They cannot be in a different room where I can't see them. Then I have to go to the other room and pick them up. So if I want to, I can do more than two dumbbell curls. Like if I'm motivated to do, and most of the days I do more than two dumbbell curls. But that is the habit I started with, and then I celebrate mentally thinking, oh, I have this burst of fireworks for me. And what happened? So what happened with me is I realized after doing that okay, I knew I had to start resistance training. Then I got a stationary bike. So now I decided every time after a meal, I'm going to get onto my stationary bike and maybe I'm going to listen to some podcast or something. That doesn't matter, but I am going to get onto my stationary bike. So after I put down and I work mostly from home. So the Tiny Habits recipe is, after I put my plate away into the sink, I'm going to get onto my stationary bike and bike for whatever time. Like that, I have, even if it's like just two pedals. And of course, most of the time, it's not just two pedals if I'm listening to an interesting podcast. So the important thing is, as we celebrate and do tiny things, we get that feeling of achievement. Okay, I am like, this is something I thought I was not the type of person who could exercise regularly. And many people have found that slowly, after feeling good, we feel motivated to do more. People have gone on to join a gym or go to the gym regularly. So first is in the behavior design part of it is, first, what is the outcome you're looking for? Is it better sleep, for example? And what are the next thing you need to come up with is, what are the different strategies that will help you sleep? Not like, your friends sleep, your parents sleep. No, what is important for you? You can come up with the strategy. From those strategies, write them down, then choose the ones that have a high impact and that you see yourself doing. Like, let us say for sleep, and I was talking about the shift worker. For that person, going to bed at 11 p.m. is not an option. So, yes, that would be great. But when he does go to bed, can he make his room very dark? Like, does he have to get dark curtains, which is a bigger build, versus getting a sleep mask and earplugs because he has to sleep in the daytime and the rest of the house is busy? So, what are the different strategies you can use, and which are the ones you see yourself implementing? So that is where the tiny, and how I do Tiny Habits programs is, people can sign up for my program, and I do workshops on Zoom and explain. And the most important thing is, I encourage people to come up with their own. I make sure that you go away with things you can do yourself. Like what Yash you will do may be very different from what maybe Siley will do or Mrinmay will do. like what is important for you, and maybe both of you are looking for the same outcome, but where you start and what you do may be very different. Okay, shall we end? I mean, this is quite late for you all.
Yeah, so I think we'll wrap it up here.
Yeah.
So thank you so much, ma'am, for taking out the time and sharing such valuable insights with us. It was really
Okay.
enlightening, and we are so glad to have had you with us today.
Thank you.